Very specific question. Suicide prevention, what is it?
Yes, great. I love that because that is exactly what I was struggling with in that moment is how is there a prevention strategy for a population of people who happen to be these physicians in my hospital, my colleagues? And what I will say is it was a long journey of looking at the science again and saying, what is evidence-based for reducing suicide risk for people? And has that been well studied? And it needs more science, but the same approach that we applied to that group of UCSD physicians and trainees is being applied right now at NYPD, at the Boston Police Department, in some workplaces around the country, in some higher ed. So there is an approach that involves 4 or 5 different levels of strategy. Universal education, finding a way, though, to make sure that people who are in that highest level of distress moment have a way that they can seek help that doesn't jeopardize themselves, their fear of what will happen if I out myself as struggling in this way. And imagine, for a physician, fear of losing your medical license. For law enforcement, fear of losing your entire career, access to your gun. So there are some significant ramifications potentially, but the truth is, if we treat our mental health proactively, more upstream, we will prevent so much suffering for ourselves, but also occupationally in terms of potential impairment. So there are a number of strategies that go into a robust suicide prevention program at the community level, and I would call the hospital-based program I was doing was not a clinical program. We were treating each other as people, members of a community. There are also clinical treatments that reduce suicide risk and making sure that everyone has access to healthcare, including mental health care, and then specifically there are some suicide risk reducing treatments like cognitive behavioral therapy, dialectical behavioral therapy, and there's a short list that I'm happy to talk more about.